Many thanks, Joseph Olsen, for that background report. With us in the studios now to discuss issues around HIV/AIDS, let's welcome the Director General of NACA, NACA being the National Agency for the Control of AIDS. It's Dr. Gambo Aliu. Dr. Aliu, good to have you on Good Morning Nigeria.
Good morning. Thank you.
Also here with us in the studios is Abdul Kadri Ibrahim. Abdul Kadri is the National Coordinator of Network of Persons Living with HIV/AIDS in Nigeria. Abdul Kadri, good morning and welcome.
Good morning and thank you.
Okay. All right, let's begin with the Director General of NACA, Dr. Gambo Aliu. I recall asking this question some time back, probably the last celebration of the World AIDS Day. Is AIDS still an issue in terms of public health concern, either globally or more particularly for us in Nigeria?
AIDS is still an issue as a public health concern globally and locally. It's the longest epidemic we've seen in our lifetime. For the last 40 years, this epidemic has been raging. We have achieved great milestones in managing HIV, but there is no cure, and HIV still kills, especially in people who have the disease but do not know they have, or they know they have but they stay away from our clinics, they stay away from our centers where free medical services are being given. The more that this stays in a person without treatment, the more that it is inches closer to making somebody sick and claiming person's life. Unfortunately, HIV still kills.
All right, thank you, Dr. Aliu. HIV still kills, and looking at the stats, the numbers that we have out there, you say over 1.6 million people in Nigeria receiving treatment. Treatment centers have increased and all of that. And I want to look at that with the theme of this year, which says equalize to end AIDS, equal access to treatment and prevention services. Now, these figures, does it include those in the rural areas?
Yes, it does. It does include people in the rural areas as well as urban areas.
Okay, Dr. Aliu, if you say that HIV/AIDS remains a global and local public health concern, why is this still concerning?
It is still concerning because there are population groups where HIV is spreading fast, and this population group, because of one reason or the other, have an equal access to our services, our prevention services and treatment services all over the country. The reasons for that unequal access may be due to stigma and discrimination, marginalization, economic inequalities. It could be cultural, it could be behavioral. Unfortunately, behaviorally, this particular group are at higher risk of acquiring HIV and at exceedingly higher risk of giving HIV to other people. These are men who have sex with men, injection drug users, female sex workers, transgenders, incarcerated individuals, marginalized people, people in IDP camps, people that do not have access to our services, especially mothers, pregnant mothers who have HIV and do not attend our antenatal services.
All right, thank you, Dr. Aliu. I'd quickly talk to the National Coordinator of Network of People Living with HIV and AIDS, Abdul Kadri Ibrahim. You just heard the Director General say that the figures of those receiving treatment and all of that includes those in the rural areas and all of that. But I'll quickly let you know what the Minister of Health said a couple of days ago. He talked about the fact that despite the availability of free treatment services, we still have a certain very high number of children living with HIV who are coming to the Minister of Health are difficult to find and place on treatment. So, why is that? And then, what do you think can be done? Because, why I asked them earlier about the 1.6 million people is because, the facts are there that there are certain people in certain parts of this country who do not have access to these, treatments, who do not have even treatment facilities. And then you talk about mothers and then children. So could you just please, enlighten us about, this particular category of people?
Okay, so thank you very much. I think the Honorable Minister of Health is right, and then comparing to also the feedback from the DG of NACA, yes, most people, especially pregnant women at the rural community, usually have difficulties in accessing HIV services, and this is because Nigeria is only depending on international aid to fight HIV and AIDS, while appreciating the government of Nigeria in putting people on treatment from the government commitment. There is still gap, especially at the local communities. For instance, in the local government, you will not really see a facility where antiretroviral treatment are being provided, and access to HIV testing services also, where these mothers will be tested to know either they have or not, and in the event their children or they are positive, then they will be referred to where they have access. So in the absence of that, definitely if a woman is positive, certainly she may not know, and she may give birth to a child and eventually breastfeed, or even during birth, and that child may become infected, and that is why it's still an issue. But one good thing about this is that Nigeria has stepped up, and in the current Global Fund program we are doing, already Nigeria is running an alignment program where Nigerian government is at the driver's seat, and the consensus now is that PMTCT, that's the prevention of mother to child of HIV transmission, which you raised, has become a priority, and it is one of the key indicators that we are pushing as part of this year's well as the slogan equalized, ensure that everybody received equal services. So by doing that, I'm pretty sure the way the program is designed, I'm pretty sure we'll be able to address some of this gap, and then deploy a lot of interventions across those communities where people can receive HIV services adequately.
What is sought to be equalized as the theme for this year's World AIDS Day suggests? Doc?
To equalize access, and this access cut across our prevention and treatment services. Prevention services, knowing about HIV, knowing how to protect yourself from HIV, and knowing about one's HIV status. Testing for HIV has now been simplified in such a way that someone can sit inside his room and test himself and know his HIV status, whether he is HIV positive or HIV negative. It has been that simple of recent days. However, access to treatment services concerning what my friend Abdul, yes, there are equal access of treatment services, perhaps sometimes because of location. And as I said earlier, in some marginalized and vulnerable population because of stigmatization and discrimination. And that stigmatization may be a stigma at the point of service provision, our clinics and hospitals by health workers. It could be stigma from family members, it could be stigma from friends, it could be stigma from community members. Knowing that this person has HIV, people treat that person differently. And what we are saying is that there has been tremendous improvement over the years. If you take this medication now and you follow up and this virus is not seen in your blood, there is no way this virus can leave you to affect another person. That is one. And there is no way this virus can make you sick, less taking your life. However, if somebody has no access or has been denied access, and this virus rage continue to grow in that person, that virus can kill. And it has been killing for the last 40 years. And it's still killing people who have no access, to services, or who have been denied access, or who know they have the services are there, but just cannot feel free or have the courage to go and access those services. And these services are free all over the country. As you have seen, or you said, our treatment size, service size have tremendously increased over 10 times over the last couple of years. From 251 when we started to now over 2,600. So the call is for people to do just two things. One, if you have known your HIV status over the last several years, it doesn't hurt to still know your HIV status today. If you don't know your HIV status and you have never tested yourself for HIV, it is wise and it is very, very important to know your HIV status. And if you know that HIV status, or you find out the status is positive, know that there are remedies or measures already in place that can keep that HIV away from harming you. And as long as you take this medication, as long as this virus is not seen when it is looked for in the blood, that virus can no longer continue to become a burden in you. However, this can only be achieved if somebody is consistent, if somebody goes to take this medication, and after giving the medication, person makes it a duty to take it on daily basis for the medicine that is being taken on daily basis, and also to come to our facility every 6 months or every 1 year to look for this virus and see whether it is still there, it's still showing or not showing. The fact that it's not showing doesn't mean it is cured. No, it is there.
I should ask you this, Dr. Aliu, in terms of your advocacy, how much of a challenge is it when you get confronted with at least two sets of attitudes? One, the perception now that HIV/AIDS, or AIDS in particular, is no longer a death sentence. And secondly, you talk about access and testing and presenting the individual for, individual presenting him or herself for testing. We have an attitude around our environments where ignorance is bliss. You say, no, I don't want to know. Because if you know, then it begins to haunt you all along. So unless there's some compulsory medical test that you will need to go for and that box needs to be ticked, somebody said, no, I don't want to know. At least something will kill somebody, but I don't want to. The person will say he doesn't want to know. So you are lost in the dark. So how do you deal with these attitudes in terms of your advocacy?
Yes, and this attitude is what we are here to change. People should know HIV no longer kills under one condition, that if you know you have it and you're taking medication, you know to fight the virus. But as long as you leave the virus and the virus is fighting you from inside, the virus is actually going to kill you. So the best thing is just know whether you have the virus or you don't have it. If you have it, then fight the virus and kill the virus. But if you don't fight the virus, then the virus will certainly continue to fight you and it will kill you. There is no doubt about it.
All right. Thank you, Dr. Aliu. You have actually said a lot about, efforts being made and then the progress being made so far, and yes, the challenges that you still have. But I'd like to ask Abdul Kadri. I talked about the numbers earlier, and of course anyone looking at the numbers would want to applaud all those involved. But I want you to tell us specifically, because I can see that there's a decline in the number of cases from 103,000 in 2019 to about 93,000 in 2021. That's massive improvement. But Kingsley asked at the beginning if HIV is still a public health concern. And anyone would want to ask that question because the campaigns have reduced drastically everywhere, in the media, on the streets, even in the hospitals. The campaign has drastically reduced. No more jingles like we used to see those days. So what really where would you actually place this improvement? The factors responsible for this improvement that we're seeing today, despite the fact that it's no longer in our faces that, HIV is killing, all the dingoes everywhere and all of that. So who would you put this great improvement on, or, the group of people, whether the public, government, or the international donors who are supporting the campaign?
So thank you very much. This is collective effort from everyone, ranging from the international partners who are providing support for this equipment for testing and also the drugs for the treatment. The government providing policies, spaces, and guidelines how program could run, including the communities themselves who are out there also to show face. For instance, I'm here and we could see waxing very well. So that's an important thing to know. But looking at the declining, yes, we are seeing a lot of improvement. But the biggest challenge is that you talked about now we are not seeing jingles and yes, because as I said, most of our interventions now and programs are becoming like targeted interventions. Even in the campaigns and the testing, we want to where we feel the issues so that we channel our resources there. And that's why you see decline in some of this. But stigma and discrimination, and most especially the attitude of healthcare workers, is the key driver that make people to find it difficult to really go to facility and access these services. And that is why we are calling for more training, because new people are coming on board from different group of people are contracting HIV. Look like the DG has talked about the key population community. These are very sensitive community people, and they live within our society, and we need to see how we can arrest some of these diseases. Then coming to HIV is no longer a death sentence. Yes, it's no longer a death sentence. The reason for that is because we have everything. We have the drugs, we have the site. Nobody is stopping you or preventing you from going. So everything is available. So it's not left for you as an individual to really take that responsibility to go, know your status, and then if you are found to be positive, then automatically enroll in care. So for that, government and partners, as government, if I have this for you and you are finding it difficult to come and take, whose fault? It's your fault. So you need to, as people, to know that it is important and critical for you, because the advantage is that once you are on medication and you achieve suppression, they talked about 90% of people in Nigeria today know their HIV status, and about 90% are on treatment. But there is another 90 that we are still lagging, the viral load, and that is the co-determinant that really shows the real progress in a person or in an infected person. Once you achieve viral suppression, you have no risks whatsoever to transmit HIV to another individual, and that is a plus in our treatment program. And that is why we call it U equals to U. Undetectable is equal to untransmittable. So once you are undetectable, and once the viral load is status and is less than 20 copies in your body, then you sort for congratulations, and family members, everybody will be happy around you.
I read recently, I tried to immediately research that while this conversation is going on, of an individual, I'm sure Doc, you probably would have also come across this, who is reputed to have had a system completely free of the virus. I think it's said to be the first individual, whether globally or otherwise, who was HIV positive, and then of course underwent a course of treatment, and the entire body now is said to be free of the virus. Good advice that you have given Abdul Kadri, namely that persons who know their status have access to treatment should, of course, encourage themselves to go and get the access, because the government has provided it. It is not your responsibility to walk in there. But from your members, what are you getting with regard to obedience to the anti-discriminatory law that we have in Nigeria with regard to HIV and AIDS stigmatization? Because you were mentioning some instances a moment ago of healthcare workers, some persons, extras. What are your members telling you about discrimination?
So we are currently running a patient education and empowerment program, and that empowerment is mainly about patient education, trying to address the literacy gap among people living with HIV, irrespective of wherever you are. And we also set up a grievance communication mechanism where an individual who have been stigmatized or discriminated, or his right has been violated by either a healthcare workers or even a community member or even a family member, can just run into our office across the country and report in a very simple way, because we realized that we have this act, but people really find it difficult to understand the content and the power it has or in it that can be able to change a lot of things. Like even the fine issue around confidentiality, all are spelled out there. So what we did was to try and interpret it in a more local language that a layman, even a akara seller, the community will understand, and also say, oh, this is it, okay. If my right has been violated, this is the step I needed to do.
So what are they telling you about the frequency of violation of their rights?
Majorly, it is a verbal abuse, actually, majorly. That, this one has HIV, or maybe from neighbors, and most of this will also come from the facility. You find that there somebody is working in a hospital setting. I have an instance myself recently in Sokoto, but what we are trying to do, we are engaging in the process to see how we can limit and identify the gap and call for improvement in terms of training, especially healthcare workers. You can't just employ somebody without giving him or her a training about confidentiality, and also placed such person in a treatment site where confidentiality is key.
All right.
You understand? So these are some of the issues, and I think we are educating people, empowering them, but majorly is verbal abuse and this side gossip, and sometimes stigma from this healthcare, because I know this is the major things that happen and what we usually receive. And then issues around a workplace, like even if somebody, I have recently a lady who was tested positive and then she was sacked from a bank where she's working. So these are some of the instances, and somebody, because he has HIV, and then he was declined from assessing admission into a defense college. So these are some of the things. So, and my brother, I don't want to mention that instance also, but we have a lot of cases in
discrimination
on discrimination.
Right. Okay, as we wrap up now, Dr. Aliyu, I'd like you to respond to the example that Kingsley gave, the fact that someone had HIV and then eventually went for test and there's nothing. Abdulkadir also mentioned that, because he said that you can get to a point where the viral load reduces so much, and then you are on, once you are, they can't test the virus, or once the virus is undetectable, then it means you cannot transmit to another person. So I want you to respond to that quickly. Have we gotten to a point where HIV has become like malaria, where you can get treated and be completely free from it? One. Then two, is it possible for us to get to 0 new infections by 2030? What really do we need to do, to get to that point?
Thank you. There are two issues here. There is the issue of cure, which is what he raised, and the issue of viral suppression, which is what we are talking about. Suppress the virus. When you suppress the virus, you keep the virus, localizing it, making sure that the virus doesn't move. But in this case, the virus has been completely eliminated, and there were 3 instances so far globally, and this has to do with some people who have cancer of the blood and they have HIV. They require marrow transplant, and before they were transplanted, the donors that provide marrow for them for transplant are the donors that are naturally resistant to HIV. There are people who are naturally immune to HIV. HIV cannot infect them even when they get exposed to HIV, because the receptor or the path that the virus cling to enter into the cells or the body defense cells is defective, so it doesn't find its way. In those instances, these individuals were transplanted with marrow of this individual that have this receptor defect, and as such, the HIV that is in them is completely eliminated, because that bone marrow that produces those immune cells that have been target of HIV in the past and have HIV are no longer there. These immune cells that have been produced are resistant to HIV, and they can no longer be infiltrated by HIV. So they are completely cured of HIV. That procedure is very intensive, and except somebody has cancer of blood or something like that, you cannot contemplate doing it, and is highly costly. It takes almost $1 million to do that. So it is not cost effective to take somebody who is well, doesn't have any cancer, doesn't have anything, to subject that person to a procedure that could lead to losing his life. So that's it. There is no cure for HIV, conventional cure now, that we can say, take this medication and you're cured of HIV. However, HIV can be made to disappear from your blood while it is still in you, and limiting its capacity to grow and limiting its capacity to leave the person that has it and affect the loved ones, as well as bring down the body defense mechanism, which serves as a barrier between the individual and all these infections that are around us every day. HIV does that. It takes away this barrier, and once it takes away that barrier, everything now comes in, and before you know it, you see the people highly emaciated, sick, having diarrhea and fever and all sorts of things in his body, and everyone looking at this person will say something is wrong here. Before you know it, people will start gossiping, is this thing is HIV. If you ask people now in the community, when last did you hear or when last did you see someone dying of HIV, you say, cannot remember, because virtually all people that have known about the status around him are taking medication, and they are looking as fresh tomatoes every day. And if you ask someone, how many times have you seen cases of HIV occupying our hospital beds? Even among the health workers, they will tell you that they don't see them much these days. And this is attributable to the ability of the individuals that are infected, to access our services and utilize our services very well. And once this is done, you will never see someone who has HIV and know that he has HIV when you look at the face of individual, or we hear that HIV has killed this person, or perhaps probably this person is on admission. So that is what we are targeting. That is ending AIDS. Ending AIDS means ending the manifestation of HIV and the complication of HIV. But HIV will still remain in people that have them until they die and die with it. And if along the way we get a cure before then that is fine. The people that are having HIV today will now get HIV taken out completely from their body. But we are not there yet.
I'm just wondering, Dr. Gamboa, you raised a number of points, but Abu Kadri also reminded us of stigma perpetrated by healthcare givers. How do we deal with that? I mean, if the advocacy is for persons to step up and know their HIV status, and knowing their HIV status, assuming it is positive, to continue to present themselves for treatment on a regular basis, and yet some healthcare givers turn around then now to be the propagators of stigma. How do you deal with this?
it requires continuous training. People require training on privacy and confidentiality, and people need to understand, and healthcare workers should be in the forefront of knowing that individuals have right to their privacy and they have right to their confidentiality, and you have no right to disclose it without their permission. If they permit you to disclose their status to someone, then now you have the right to do so. But if they don't, they have the right to disclose their status to someone they feel like comfortable disclosing, but you have no right, and it's a crime if you do that. So our health workers, I think over time we have done something, and we are now even doing more, because we have a training now that is taking place in virtually all our centers all over the country where HIV clinical services have been provided. And these trainings are part of it. Training on privacy, training on confidentiality. With time, we are very confident that, because there is the gradual decline on that right now, we don't have it as much as we have it in the past. So we're very hopeful if we continue at the rate we're going, we will reach a stage where the core health workers will be telling individuals and will be training their peers that privacy and confidentiality are key, and keeping those rights, is something that is mandatory, and violating them will land somebody to jail.
Thank you so much, Dr. Gambo Aliyu, Director General, National Agency for the Control of AIDS, NACA. Thank you so much for joining us on the program today, and of course for all that you have made us to know as regards AIDS today. We also want to appreciate the National Coordinator of Network of People Living with HIV and AIDS Nigeria, NEPFON, Abdul Kadri Ibrahim. Thank you so much. And yes, happy World AIDS Day. Today is World AIDS Day, December 1. And as we celebrate Equalize to End AIDS, equal access to treatment and prevention services, we wish you the very best. And we hope that next year, when we come to talk about this, the figures would have gone down even more. And maybe we'll be close to zero, right, Doctor?
Sure.
Okay.
Definitely. Thank you.
Thank you so much. So we'll take a break now. When we come back, we shall get into the second part of the discussion, which is on inclusion of persons with disability. Please stay.